Good afternoon, everyone. Thank you for joining PHCA for today's webinar, Behold the Power of Data for Assisted Living and Personal Care Providers. I'm Wendy Johnson with the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. Before we begin, I have a few housekeeping items to cover. The webinar is being recorded and will be made available on the PHCA website later today. The webinar has been approved for one continuing education credit for PHCA member nursing homes, assisted living, and personal care home administrators. Certificates will be emailed tomorrow, and please note that effective April 1st, we are required to upload the credits to the NAB registry. So hopefully you have registered for this free service and have provided us with your unique NAB registry number. Tomorrow, I'll be sending a link to a quick survey. Please complete the survey, and if you're participating in a group setting, have each participant also complete the survey. Your feedback is important to us and our speaker. All attendees will be in listen-only mode. However, throughout the presentation, you can feel free to submit questions using your questions pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Now for today's webinar. Today's webinar is being presented by Dr. Lindsay Schwartz, Associate Vice President, Workforce and Quality Improvement with AHCA NCAL. Today you will learn how AHCA NCAL resources can help your organization harness the untapped power of data you collect. With an updated dashboard and new measures in Long-Term Care Trend Tracker, your assisted living residence or personal care home can thrive in this data-driven atmosphere. The webinar will include an overview of several key long-term care trend tracker features and reports. Your learning objectives include how to upload data into long-term care trend tracker, how to modify your dashboard in long-term care trend tracker, and lastly, how to run, save, and schedule reports in the long-term care trend tracker. I'll now turn the webinar over to Lindsay.
Thanks, Wendy, and hello, everyone, and thanks for joining. I know everyone's busy, so I appreciate the time today you're taking with me to learn more about LTC Trend Tracker. I am going to be flipping through a couple screens. So we have our LTC Trend Tracker website. I'll take us into LTC Trend Tracker, the tool that's on the web, and I'll also be going back and forth to a PowerPoint that Wendy's put out as a handout that gives you some of the screenshots you'll be seeing today, so you can go back and refer to it, and discusses some of the measures in detail, which we'll go over. So I first wanted to start out with showing you the LTC Trend Tracker website. It's easy to get to. It's just ltctrendtracker.com. It does redirect to our AHCA NCAL website, but this is where you do everything with Trend Tracker, where you can log in. If you haven't registered, you can do that there. If you are part of a large organization, you'll hear me say this a lot, you will need to find out who your account administrator is for LTC Trend Tracker. If you don't know that, we can answer that question. I'll show you how to reach us at the help desk and get you connected. If you're an independent owner, you can just go ahead and register. If you oversee your communities, you can register on your own. The important reason to register or work with your account administrator is we want to connect communities that belong together and are owned by the same organization, because I'll show you there in LTC Trend Tracker, you can look at organization goals and everything outcome-wise, so everyone goes together, and you can compare yourself within your organization and against other peers. A few important things I want to point out while we're on this website. One is find your NCAL ID here. You need your NCAL ID for numerous things in LTC Trend Tracker. One of those, very important, is signing up. It's just very easy. You click on find your NCAL ID here, you enter in your zip code, and it will pull up your NCAL ID. We use an NCAL ID. It's just something NCAL developed because for skilled nursing, we use the Medicare provider number. Assisted livings obviously don't have a Medicare provider number, but we needed some kind of unique identifier to be able to link all of your data together when you upload it into Trend Tracker. Again, all you need to do is just scroll down, enter your zip code, and you'll find your NCAL ID. I also want to point out a couple other great resources. Our Resource Center is where you can go to get information. It's broken down. If you're an account administrator, this tells you how to add and delete users. You can manage your account. Assisted living has its own section, so we're going to talk about a lot of these things today, how to generate a report, how to do your measures upload. So if you forget any of the things I go over today, you can go back and refer to these. These PDFs have nice screenshots with arrows and tell you where things go. If you're doing anything with turnover and retention or core Q, that would also be under uploading data. Since those are measures that are available for both AL and skilled, they're in our general section. And then we also have a section on using the system. And these are basic how to schedule and save reports, some nice videos, how to build and save peer groups, which we'll go over all that, but I just want to let you know it's here in case you forget it and need to come back and maybe get some more information. We also have a great FAQs page, frequently asked questions. This is a living document, I tell people, so if there's a frequently asked question, we do use a help system, which I'll give you that email and show you here where you can contact us. We go through every once in a while, see if we're having frequently asked questions, and we do update this. So we always encourage people, if you have a question, to check FAQs in the Resource Center, because a lot of times the questions can be answered there. And if you can't find it, you can always contact us. And the reason we have you go through either our contact us, you can do this, or you can just email help@LTC Trend Tracker. It says, please allow 3 to 5 business days, but usually we get a response back within 1 business day. It may just be that we're working on it. If it's something that we can't do and we have to work with our vendor partner, it usually can take a little longer than a business day, but Synaptitude, who we work with, is very quick. We ask you to use this system because it's actually a ticket system, so we have record of it. We can make sure it gets answered in a timely fashion instead of emailing us individually, whereas we all know sometimes emails get lost in people's inboxes or accidentally go into a spam folder. On that too, I just want to note, you'll want to add our help@LTC Trend Tracker email to your safe sender list. A lot of people say I never heard from LTC Trend Tracker, and that's because we tend to go into the spam box, unfortunately. So we just always ask people to add us to your safe sender list, or if you have an IT department, to ask them to do that. I'm now going to switch over to our PowerPoint for just a couple slides. And as I mentioned before, in the PowerPoint, I did make sure to include some of these slides just showing you where to go. It has our website. This talks a little bit about registration. We do, if you are new to registration and you'll be asked about something, is your bed size. This does not impact your membership. We were trying to use CRM, which is our membership database, where we get information from our state affiliates, like Pennsylvania Healthcare Association, and we realized that states determine bed size differently. A lot of times it depends on licensure, so we aren't able to use our CRM bed count. So we do ask for your bed count now. If you get an error in Trend Tracker that you are trying to add too many residents and your bed size isn't high enough, that is also something we use to capture to make sure that you're not adding more residents than you have actual beds. It's just a data check. We can update your beds, and you'll get a little notification that just says email us at help@LTC Trend Tracker. We can update that historically, so you can go back and add data and update it, so moving forward you'll have an accurate count. Again, this is just showing where you register, log in, or find help. Your account administrator, as I mentioned before, if you're part of a larger organization, you are likely in LTC Trend Tracker, especially if you work with a skilled nursing. Skilled nursing has been in Trend Tracker from the beginning. Assisted living was added in 2015. And your account administrator really is the individual that can set you up. They can give you login credentials, build attachments, and give you permissions. So all of the information I talk about today, the turnover and retention report, Core Q, and the NCAL measures are permission-based, which means that your account administrator has to give you special permission when they're adding you in to do those. The NCAL measures are all the way at the bottom. So one of the most common things that I'm going to show you in Trend Tracker is I can't see where the upload is. If that's the case, it means you don't have permission and you need to ask your account administrator for permission. Staff cannot grant that permission, but we can tell you who your account administrator is. Now I'm going to go ahead and switch over to Trend Tracker to show you kind of live screens and how we go, and I'll switch back as I talk about data uploads. Again, I have in the slides how you upload data and just some nice screenshots that you can use after the webinar. So today I'm going to show you our demo website. We never use our real Trend Tracker website because it has real data in it. So this is all dummy data. Let me just refresh my screen here to pull up the data in our demo site. And also just want to let you know, in our demo site, I have full administrative rights. So you are going to see things on my left-hand menu that are not available likely to you, even as an account administrator, as this is also administration, which is our AHCA NCAL staff access to LTC Trend Tracker. So I want to point a few things out. This is the dashboard that you will see when you log into Trend Tracker, unless you also are with a skilled nursing. You may first see your skilled nursing dashboard. So if that is the case and you want to toggle over to your AL dashboard, you will just go over here to your left-hand menu, click on dashboards, and then select your AL dashboard. Same thing if you were just wanting to select back to SNF, you would just click on SNF dashboard. Here you can click on our help, and this launches our help menu. It is very long and has a lot of help information in it, but some people prefer to go back to our resource center, which you can reach just clicking on the AHCA and NCAL icons up here. So our dashboard was our newest addition for LTC Trend Tracker. It is a dynamic dashboard, so assisted living has actually a dynamic dashboard. SNF does not. We are working on the skilled nursing one. And by dynamic, we mean that you can really make it your own. So as you see here, my login ID, it is not showing my user, but when I log in, my user ID would show there who I am. It would be Lindsay Schwartz, and my login ID, as I mentioned, I'm just in a demo account. This will always tell you what organization you are linked to. It will tell you who your buildings are, who's it showing. So it's only showing my one building, and who your peers are, which we're going to talk about that. So you don't have to remember who you select. You will see I have 4 different measures here: my hospital readmissions, my resident satisfaction rating, turnover, and occupancy rate. Down here is where you can see all of the different measures for assisted living and LTC Trend Tracker. So the NCAL measures are our newest ones that were added in fall of 2016. Those are the hospital admissions, readmissions, off-label use of antipsychotics, and occupancy rate. You'll see how your org is doing, or if you're just one assisted living, how your assisted living is doing, how your peers are, and how your you will have a little arrow indicating the trend. So a red arrow is a bad trend, green is good, and blue is just neutral. So if it's going up, it means that you're going up, and that is not good. So for hospital admissions, an increase would be a bad trend. You'll see this, it's just a nice quick way to see how you're doing. If you don't see an arrow, which I think we had one for NCAL measures, it just means that you don't have a trend to look at. It looks like all of these do have trends. There's the blue arrow. Again, that's neutral. It means there was no change. If you just have no arrow, as I mentioned before, it just means that was the first number that you've had and there's nothing to trend against. You'll see this little icon. Some people call it a carrot. I call it a little arrow that you click on to get to more additional measures. As long as it is there, you will continue to click till you see the rest of the measures. We also have Core Q along with the AL turnover and retention. Oh, and there we go. Core Q doesn't have an arrow. So that just means it's my first time in here with CoreQ, and there's nothing to trend against. Now, as I mentioned before, we have these 4 measures up here. And using those, you just click down and it shows you a nice chart. And I will make note, our demo site is always a little bit slow. Please don't worry, LTC Trend Tracker that you guys use is not this slow. So I always worry when I give a webinar that people worry that we have a very slow system. So as I mentioned before, this is dynamic. What's nice is you saw that I clicked on resident satisfaction. It gives you your org right here, your peers, but it also gives you a nice graph. And I'll show you how you can also run these graphs through the report tool. But what's really nice is that you can export all of this by PDF, or you can modify the dashboard. As I said, it's dynamic, and this is how you modify it. So say I don't want to use those 4 measures anymore on the side, and I have different measures that I want to look at. So let's see, I'm really focused on hospital readmissions, resident satisfaction, let's do aid turnover, and let's go ahead and pick hospital admissions because I'm really focused on the quality initiative. And we'll actually focus, let's see, the one we're missing is off-label use. So we'll use off-label use of antipsychotics. This is the same thing you will do for reports, which we'll go through. So you're going to hear me say this a lot. This selection depends on your access. If you are an administrator over 1 assisted living, you may only have access to that 1 assisted living. If you are a VP over many assisted livings or a regional director, you may see numerous assisted livings, and you can select your whole provider organization, or you can go through and select individual organizations. You can also choose a building group. As you'll see, these are all of our tests. So I will show you how to do a building group a little later, but it's just a nice way if you want to go ahead and group, say you're regional and you want to group by regions or other ways, you can do that. Again, if you have access to different communities, I can select all of these communities, or I can just leave it as 1. So I mentioned I'll show you how to save a selected group. So exactly what I just did where I was selecting them, you can just click that, save a selected group, and name the group, and that group will then immediately appear right here. You can also limit your peers geographically. So again, this is based on how many peers you have. So I will give you all a challenge in Pennsylvania. Try to get everyone to submit data so you can have really good data and you can drill down. You have to have at least 5 peers in a category to show data. We do not expect you to know that, but Trend Tracker knows that and will just deliver no data if you really drill down, which I'll show you. So you have the opportunity, as I mentioned, to go drilling down by geography. So nation, state, county, city, zip code. You can also look at congressional district, CMS region, or MSA, CBSA. Again, if you try to drill down too far and there's not enough, you just won't get any data. You can also, what's really nice is if you get enough data, say in Pennsylvania, you can select Pennsylvania right here, and you can start looking at counties and select one of those. So let's look here, Pennsylvania. I'm going to select Allegheny. I was born in Pittsburgh, so that is familiar to me, and Lancaster here. Now, again, you have to have 5 communities. We don't expect you to know that, but Trend Tracker knows that. So it's just going to have to be trial and error. But I'd encourage you to encourage your peers to submit data so you guys can have really robust peer data. You can also then drill down city. Again, you have to pick the state, which if we've already picked Pennsylvania, it knows that, and you can go through and do that. So I'm going to stay really high level. We don't have as much data in our dummy data. As I mentioned, this is our demo site, so I don't want to drill down too much. You also can limit your peers by different organization type. So ownership type, for-profit, not-for-profit, government, and all the others there. You can look at urban versus rural. And then we have different AHCA membership groups. CPAC is for SNFs, but I'm sure we'll continue to grow and expand these peers. Now, a very important part, we're going to unselect that, is do you want to be included in your peers? I get this question a lot, so I will just say this. It is completely up to you. If you are part of a large organization and you are the majority of the data that is in there, you just need to know that you are comparing yourself to yourself. And you would know that when you run it and you see the data that you are a majority of the data, that how many communities is making up the majority of that. Totally up to you. I would suggest not being in the peers because you want to see who your true benchmark is, not benchmark against yourself. You can also limit by bed count. You can select as many of these as you want. So if I want to do under 50 beds, I can select those 3 categories, and then I save my dashboard criteria. It's really important that each user has their own login. This is why we say this, because you can really update and change things in a way that works for you. You can modify your dashboard to show the different communities or different peers you've selected and different measures. I always liken it to my radio in my car. My husband drives a separate car. It's like getting in someone's car and changing all the radio stations. That's annoying. So we always suggest using your own and being able really to modify and adjust the system so it fits your needs. As you saw, I changed the top one to hospital readmissions, so now it's showing me that my peer comparison is yellow. My centers or communities are blue. It shows all the buildings. Remember, I chose all of those 4 buildings. This will not change until you go in and change this. So if I exit out of this, come back tomorrow, and look at this, it will say the same exact thing until I go in and modify my dashboard. Now, I want to point out goals. We're really excited. We know for a fact that setting goals is really important for quality improvement. Of course, you want to set SMART goals, goals that are achievable, measurable, realistic, and time-bound, and of course, specific. We use the Quality Initiative, which you can go to our website, NCAL.org, to find out those, and I suggest using those as your benchmarks or for setting goals. How you do that is you just click on Set Goals, and it will pull up your ability to set goals. Now, there are organizational goals and membership goals and community goals. So you have to first pick a building. I'm going to go ahead and pick this top building. You will see I have access to both. Again, I have administrative rights when I'm in the demo site, so you may not see organizational goals that you can change, depending on your access. But that's okay. You'll always be able to change your goals for your community. So just let's say my organization has 30% hospital readmissions as their goal, and I'm a real goal getter, so I want my goal to be 20%. That's why we did that, because you may have more aggressive goals than your organization. Or you may just want to start slow, and maybe your hospital readmissions is very high and you'd like to just see a 10% decrease. You can go in and change these as much as you want, and you will see there is the opportunity to set goals for every measure that ALs have, all of your turnover and retention measures and all of your core Q measures, including response rates and satisfaction rating. Response rates are incredibly important to your overall outcome. You want to have a high response rate. So once you change these, you just want to make sure that you save your goals. It'll let you know that the goals are then saved. You'd click OK, and then you can return up here to your dashboard. As we're returning to the dashboard, I'd really highly recommend setting goals. I've heard from people that they weren't using goals, and it's a great way, as I mentioned before, to really set goals and achieve them and work with your teams to achieve those goals. One of the great things about LTC Trend Tracker is you can export everything to Excel. I'll show you on the reports too, but you can export this that has all your goals and information to Excel, which is a really nice feature. We see that a lot when we have members that are applying for our National Quality Award program. And that allows people to download data. And again, I'll show you this when we run the reports, so you can have historical data. We're going to go back here over to our left-hand menu and click on Run Report. So I know I'm kind of doing this backwards, but I'm just going to go through the menu and then we'll get to upload data. So what's great for us is the reports are alphabetized and AL quality measures report is the first one. Now I am going to point a couple of things out to you. We have a staff turnover and retention report. It is a dual report. So if you are part of a skilled nursing and have access to the skilled nursing data, you may want to run that report so you can have a combined overall turnover and retention for skilled and AL, and then you have the separate AL and skilled. But if you're just AL, you can easily include staff turnover and retention. The AL quality measures report includes all of the measures. Dynamic, you have the opportunity to only include a few, which I'm going to show you now. This probably looks familiar, just like we did the dashboard, that you can limit your buildings. You can build a building group, as I mentioned before. We've already done a PHCA webinar before, so that's why you see PHCA there. And then you can also choose your communities. Again, you can limit your peer results. If you don't choose anything, the peer is always defaulted to nation. You don't even have to click that, actually. I do want to point out, though, before you run the report, make sure you go to Customize Report. This is the only dynamic report so far in Trend Tracker, but we're doing this now with other reports. So this was our jumping off point. So what we mean by dynamic is the same thing as the dashboard. You can make it your own. So as you see, we start up here with data intervals. You can do 1 month. You are going to get a warning just letting you know that choosing 1 month and quarterly are small, and data is better when it's in the aggregate. So we do suggest 6 months and 1 year rolling, but we know a lot of people want to look at 1 month and 1 quarter. So that's why they're in there, but we just do a friendly reminder. You can also choose if you want to show your number of communities. This is really important so you know how many is in your peers and how many is in your count too. So I always suggest choosing that, and that's why it also is default. You can also select any of these measures. So maybe I'm going to a hospital and I want to talk about my readmissions and admissions, and I really want to take off occupancy rate and off-label use of antipsychotics. You also can see that it's going to show you what the numbers currently are and the trend, which is really nice as you're going through this. AL turnover and retention, you don't have an option to break down because it is a 1 year measure. We do that annually. The other measures up above are monthly measures that LTC Trend Tracker aggregates on its own. So say I mentioned I'm going to the hospital and I'm again going to keep number of communities, all staff turnover, but I'm going to take out my retention rate. I don't really want to share that at this time, and just do an maybe all staff turnover, maybe director of nursing, and then direct care staff. I do want to include core Q, and I can do both a 6 month and a 1 year rolling window. And we're going to go ahead and keep both resident and family satisfaction. So you can, what's really nice is use this layout. Say you want this to be standard, you can just check there and it will be your standard layout until you come in and change it. I'm not going to do that right now, but we will go ahead and run the report. And as we wait for the report to pull up, you will see when it pulls up. There we go. Again, all the information you have on the dashboard too. So it tells you your selection criteria, who your peers are, and also NCAL measures. Now, as I mentioned before, we don't have the same data in our demo account. So if I ran this under my name, you would see real data and there would be data for 1 month, 1 quarter, 6 months, and 1 year. Now, what's really nice is you click on the plus sign and it will give you information. So again, you may just see one center depending on your administrative rights, but it breaks down who is in those. So as you can see, number of residents who spent the night in the hospital, number of residents in the community, and then the hospital admissions. So it is your raw data being shown there. Now, you can export, if you just want to export your hospital admissions data, you can do that, or you can come up here and export all the data to an Excel file. Again, we see a lot of people doing that to use for the quality awards applications. Maybe you don't like our graphs, which I'm going to show you. Maybe you like them in a different color. or you want to do other analyses on them. So that's why you can export to Excel. You can also export this to PDF if you just want to utilize this report how it is. And again, same thing with turnover and retention. You just go ahead and click there and it will show you the breakdown. You will see 3 years back. Please don't fret. Again, this is a demo site. We don't have 2017 data in there. There is 2016 and 2017 data in LTC Trend Tracker. So please don't panic when you see back data for this. You can come down here, start a new report, change selections. You can also do that again up here if you want to re-customize it. Now you probably see as I've been scrolling this little button to click more. So I'm on hospital admissions. If I click more, it's going to take me to our nice little charts. Now, you can print these charts. It will print out everything, your selection criteria, this nice little table here. You can export to Excel. You can export the chart. Again, maybe you don't like blue or yellow. Don't blame me, I didn't pick those colors. Maybe you like different colors. And that's what you can do when you export to Excel, or as I mentioned, maybe you like to look at the data, you're a fellow data nerd like myself and want to play with that and maybe run some additional analyses or utilize the data in a quality awards application. I just want to go through this really quickly on Save or Schedule a Report. Here on the left-hand side, I love this. It is like a set and forget kind of thing. So say you have a standing meeting and you just need to be emailed a link where you can click and you still have to log in to LTC Trend Tracker, but your report is already there. Well, you can do that. This looks familiar. It's the same thing you do for the dashboard. It's the same thing you do for running a regular report. You just set up the report, limit your buildings, limit your peers. Down here is where you can do this and set it. So you have options to run quarterly. You can pick the first day of the quarter or any day. Maybe you have different days. You can run monthly, select a day. You can run monthly on a specific day, or you can just save this report and not run. You can save as many reports as you want. You can customize the report, very important, like I showed you for assisted living, so you can customize what you want in that report, what measures, and what time frames. And then you just click Schedule a Report. You're going to see, as I mentioned, you can save and schedule as many as you want. You can tell we do a lot of demos by this. We've saved a lot of reports from the staff here. You can then go in, you can remove them, or you can run them immediately. Just a really nice thing to do. Now, we are going to go back and do upload data. So on your left-hand side, if you are looking at LTC Trend Tracker, you click on upload data and you see nothing. It means you don't have access. And again, your account administrator has to give you that access. I'm going to focus on NCAL measures, but I do just want to quickly take you through the turnover and retention upload. You want to download the turnover and retention template. You always want to make sure you're using the most current one. If we update these, we typically send an email out to all users, but we know how emails are. Sometimes they go to spam. So you really want to make sure you have the most updated one, because if you don't, you will get errors because of that. We have some instructions on uploading. Always remember to save it, and I'm going to show you some important tips on the NCAL measures upload. This is the same for CoreQ. I will tell you, go ahead and if you work with a customer satisfaction vendor, CoreQ is our set of customer satisfaction measures we developed at AHCA NCAL. There are 5 of them. So 3 are with skilled nursing. There's a family and a resident long stay, a short stay resident, our patient, and then assisted living family and resident. The skilled nursing ones have been NQF endorsed. The assisted living are under consideration for NQF endorsement. And we have many vendors. If you go to coreq.org, you will see all the information, including the questions and vendors that include the survey. If you don't see your vendor, you can just contact us at help@LTC Trend Tracker or CoreQ. We have a contact on CoreQ, and we can work with your vendor to get them set up. We have 17 vendors that will automatically upload your data into LTC Trend Tracker for CoreQ. So if it was me, I would suggest doing that. But if you want to upload your own, you still can. You would download your template and upload that data. Today we're going to focus on the NCAL measures though. So as I mentioned, you're going to download the NCAL measures template. I did not follow my own instructions. I actually have an old template. I need to download the new one. The new one has additional years listed. So don't follow what I do, follow what I say. You'll also see some instructions right here. So I'm going to pull this up. This is just a very basic, hopefully you all can see this, I'll make it a little bigger, Excel spreadsheet. It is important though, you don't go and develop your own spreadsheet. This spreadsheet works with LTC Trend Tracker. If you went and developed your own or got one from someone else, it would not work with LTC Trend Tracker. So you have to put in your NCAL ID, your community name, ignore vendor name. We're set up to use an API, but that's not used yet. And the years. As you'll see, I only have 2017 on here, but the new one goes much further in years. You want to use the drop down. Something that we have learned is if you do not use the drop down and type it in, sometimes that will cause an error. So use a drop down where you see an arrow and actually select it. You'll want to put the number of residents in the community on the last day of the month. Hospital admissions, the number of residents who spent one night in the hospital. We're going to go through these calculations, so don't worry about that. Off-label use of antipsychotics, and then hospital readmissions. Now, I suggest doing all of them. If you are only tracking one, you can do that. You don't have to put a number in each. Do not put a 0 though. Leave it blank because a 0 will be calculated. There's also instructions here too, and a way to get to find your NCAL ID if you forgot that. So most importantly, when you save this, save it in a place you remember. You will browse. And find your upload file, and then click upload. You will probably wait expecting and hoping that there are no errors. I always do, even when I use a demo one. Whew. So you will sometimes have errors, and it will tell you where that error is, what your column and what your row is. Please do not get so frustrated that you walk away. We hear this, and we are here to help. We want to help you, so you can email us at help. We will ask you, so I always suggest, go ahead and send us in that email an attachment of your file that you're trying to upload. Many times, I've just been able to look. I can immediately tell what the error is, and we can get it fixed, and you can get it uploaded and on your way. Now, I'm not done. I'm going to tell you the most common error in Trend Tracker on uploading data. People walk away after this. You absolutely have to hit Submit as Final, or your data will not be there. You want to see the file was submitted successfully. I always tell people, go check your dashboard. The data will immediately show up. It's instantaneous. Trend Tracker immediately calculates it. So you don't have to wait on data to get there. It is immediately there, which is great. You can also download data. We get this a lot. Again, this is a permission-based, but if you need historical data for your quality awards application, that's where we get a lot of questions typically, you can do that. You would just go through, you'd select the measure, buildings again, it's just like running a report, and then you select the time frame. So that's also really helpful. I'm now going to go ahead and switch over to calculations, but first I think I'll check here to see if we have any questions on Trend Tracker. If you don't yet, that's fine. We can always go back, but I'll just check real quick to see if we have any questions. It looks like we do not have any questions. Great. So we're going to go ahead and move back over to the PowerPoint. So I want to go through calculations. We get a lot of questions on these. And again, you will have these slides, the handout. Wendy will make sure you have them. And we also have this information in our resource center under assisted living and upload guide. So hospital admissions. The numerator is the number of residents who spent the night in the hospital. The denominator is the number of residents in your assisted living on the last day of the month. We have a steering committee for LTC Trend Tracker made up of all members, and they chose the measure, the denominator, to use number of residents in the last AL on the month, in the AL on the last day of the month. We know there's many ways to calculate hospital admissions, readmissions, and off-label use of antipsychotics. We had to go with a way of standardizing it and just choosing one. So if it's not exactly how you do it, we do ask that you calculate it this way if you are going to be putting it in LTC Trend Tracker. What I've tried to do, and it may be a little hard to see, is this, the number of residents who spent the night in the hospital, is a subset of the number of residents in your AL on the last day of the month. So it can't be residents who were not in your AL on the last day of the month, if that makes sense. This includes both observations and admissions. It's nearly impossible still, unfortunately, to a lot of times tell if someone was actually admitted or just on observations day. So we've found out through years of doing this that it is just better at this point to include both observation and admission. It does not include ER-only visits. Hospital readmissions. So this is the number of residents sent back to the hospital within 30 days of being admitted to the AL directly from the hospital. So you are only looking at residents that come directly to your assisted living from the hospital. They do not go to skilled nursing. They do not go home. They come directly to the assisted living. We're including observation and admission stays and excluding planned admissions or ER-only visits. I want to do a quick example. We get a lot of questions on this, and if you have 10 residents, I like to use January because that's a difficult month, because February is a short month, so you'll see why. If you have 10 residents, and I know this is a lot for skilled nursing, that come directly from the hospital to assisted living, and 4 of them go back. Those 3 you would include in your readmissions calculation for January would be these first 3. You'd even include the March one because that person came back to your assisted living on January 31st. Their readmissions 30-day clock starts ticking on that day, which goes to March 1st because February is a short month. The person that goes back on March 15th would not be included. That's after 30 days of initial discharge. So they would not be included. Your readmission would be 3 out of 10. I know this is really probably hard to see because it's an Excel spreadsheet, but you would put 3 down. So 10 is actually first, your denominator for the number of residents admitted directly from the AL, and this is for January. And number of residents that went back would be 3. We have some frequently asked questions around this. Do I count emergency department visits? No. Observation and admissions count only. Can my numerator, so the number on the top, be bigger than the denominator? No. We have some tips too. So the residents in your numerator, those sent to the hospital for admission or observation, have to also be in your denominator. Another example, I actually have to thank a member for this. They sent a really wonderful example in an email, and I literally just took it apart and used it and actually gave people names so you could kind of follow the residents. So I have 3 residents, Sue, Mary, and Dave. They all went to the hospital in October and were in the assisted living on 10/31. So they're counted. Those are hospital admission stays. So for October, my admissions would be Sue, Mary, and Dave, 3. Denominator is Sue, Mary, Dave, plus all the rest of your residents in your AL on 10/31. I have 100 total residents on 10/31. Which includes Sue, Mary, and Dave. So for October, I would put 100 as residents and 3 for hospital admissions in my upload sheet. Now, if Sue, Mary, and Dave all came back on 10/30, they would be at risk for the hospital readmission for 30 days out, or 11/30, to count for the October hospital readmissions measure. If all 3 went back before their 30 days, they would be counted in the October hospital readmissions measure, not the November hospital readmissions measure. That trips a lot of people up. So this is your October hospital readmission. It's the numerator, which is Sue, Mary, and Dave, divided by the denominator, Sue, Mary, and Dave, which would be 100%. All three that came directly from the hospital to the AL all went back. So it's 100%. We also get asked a lot about off-label use of antipsychotics. So it's the number of residents prescribed an off-label antipsychotic. We don't expect you to memorize this. If you go into our resource center, we have a nice chart that shows you what's off-label, and it shows you what are approved diagnoses. If there is a diagnosis not approved by the FDA, it means it's off-label. We do it a little differently than CMS does theirs. We don't count bipolar disorder because bipolar disorder is an approved FDA diagnosis for certain antipsychotics. And we just have a note there that talks about, you can find this information too in the resource center. So frequently asked questions about off-label antipsychotics. As I mentioned before, what does off-label mean? It just means the antipsychotic is prescribed for a diagnosis not approved by the FDA. How do you know that? We have a nice little chart to tell you that. I also just want to go through a checklist for submitting data. We developed this because we had a lot of questions, and we just thought, you know, we're quality people, we love a good checklist. So I like it, it's easy to use. So you want to download your data entry sheet. It's been updated for 2018, so if you downloaded it in 2017, you do need to download an updated one. Enter your data, make sure to save it in somewhere you remember. Hopefully your Dropbox isn't as crazy as mine looks and hard to find things. You then want to upload data and make sure you receive the message data was uploaded successfully. Remember, I showed you that. Really important step. I hear that a lot. You can immediately go to a report, run it, and make sure that everything is there. If you don't see it, your upload wasn't successful. And you can go to the next slide. So what happens when I don't see my data? Double check the upload sheet and make sure you have the correct month and year. You might be laughing, but that happens. We're all busy. We sometimes click on things quickly and didn't check it. You may just have the wrong month. Make sure you're using upload Excel file and not the download file. So you don't want to go to download data, download that file and try to upload it. That's not the upload sheet. Try to upload again and check to see if your data is there. If it isn't, then go ahead and send it an email to us explaining the problem and attaching your upload sheet at help@ltctrendtracker.com, and we'll get back to you. Again, if you have questions about Trend Tracker, we ask you contact us through help@ltctrendtracker.com. It's not that I don't want to get personal emails. It's just that we have 3 to 4 people working on this at any time, kind of overseeing the help desk. And then they send emails out to, a lot of times if it's a question about measures with assisted living or core Q or turnover and retention, I typically answer those, so sometimes they'll get sent to me and you'll get a response directly from me, but it just helps us to be efficient and make sure we're answering your questions in a timely manner. So that is all for today. I'm going to go ahead and exit out of this and see if we have any questions. I'm more than happy to go back to any of those slides, which, as I mentioned before, Wendy will be sharing those with you, or go back into our webinar, our LTC Trend Tracker demo site, if you would like to see any demos again. So I'll go ahead and open it up to questions where you can type in the chat box or your questions box.
Thanks, Lindsay. It was great information today. And like Lindsay said, we're opening it up for questions now, so you can type those in the question pane on the right-hand side if you have any questions for Lindsay today. We'll give it a minute or two. It's a quiet group today. And while we're waiting, I'll just let you know, just keep in mind we do have some webinars scheduled for August, September. We don't have those up and ready yet, but we will be updating that throughout the summer. So keep an eye on upcoming webinars. We're trying to get some webinars scheduled for the MCOs for the month of July. We're working with them to get some dates on the calendar. and we'll have more, more webinars, like I said, throughout the summer and into the fall. So keep an eye out for those. We're not quite, we don't have those quite ready yet. Oh, here we have a question. Lindsay, can you see the question?
No.
Give me a second. Okay. Oh, here we go.
Oh, yep. Okay. Does the reason the resident returns to the hospital factor into the counting of resident returns, admitted after UTI and within 30 days? Excellent question, and I apologize I didn't include that. It does not matter. So we are not looking at condition-specific admissions or readmissions. And remember, a lot of times they are related when we think they may not be. So if someone goes in for a UTI and comes back and ends up falling, a lot of times that's related because people aren't getting up and moving around in a hospital or getting proper nutrition.
Great. Do we have any more questions today? Again, we'll be sending out contact information for the Trend Tracker helpline that's available to you. And like I said, we'll give it another minute or two. Don't forget to fill out your survey that you'll get tomorrow. The recording of today's webinar will be made available on the PHCA website. And I'm not seeing any more questions, so we'll go ahead and wrap things up. Thank you again to Lindsay for presenting on this topic today. We really appreciate it. And everybody have a great remainder to your week and a great weekend going into the holiday week.